I'm Dr. Leo Powers, and today we're going to talk at my office in Plover, Wisconsin about the gluteal muscles. And we're going to work on restoring the muscle integrity of the gluteal muscles. And the gluteal muscles there's three gluteal muscles, the Gluteus Maximus, Medius, and Minimus. And so there's three gluteal muscles, just like there's three main lobes of the brain. Well, there's four, but the frontal, that's the thinking and short-term memory and language. The temporal, that's hearing and auditory, and then occiput is visual part. And then the parietal area is the support system. That's the adrenals of the head. So basically, there's three parts there, and when you breathe in, the cerebrospinal fluid flows down to the pelvis, and when you breathe out, it flows back up. And so it's really important that it flows back up, because otherwise your brain is not going to work quite as good, and the rest of your body won't work as good. So basically, I start, if they have all three out of balance, I start usually on the Gluteus Medius or Minimus, and so you get that CSF flow back up. And when you have mechanical stress in the Gluteus Medius, that ties in with the eyes area, right up here, and then it ties in with the occiput. And when the minimus is off, then that ties in with the frontal lobe up in here, and the maximus ties in with the temporal lobe, right up in there. And so when you breathe in the Gluteus Maximus, they start to work, and then that helps to flow the cerebrospinal fluid down the spine, and when you breathe out, it moves back up. And so these Gluteus Medius, Minimus, and Maximus muscles all have a connection to the hand and foot bone that I talked about, restoring of a muscle. And we've done that, and when we restore the muscle, this is yang, this is yin, and we work on the yang component first. There's a yang within the yang and a yang within the yin, and then you just one yang component of the head for endurance. Once that's completed and you work on the gut work, then a lot of times this is tied in with your breathing. So you're not breathing in and out as much, and so you're having shallow breathing. And that's part of retained primitive reflexes, the fear paralysis one. And so when that happens, you're shallow breathing, and it's kind of like if you go out in the woods and see a rabbit, and it'll freeze and it won't move, and it breathes just a little bit. Or if you see a fawn, a baby deer, and if it's laying there, it'll just stay still and it won't breathe very much, so you don't see it move. And you're doing that when these are stressed in here. And so what happens when that happens is then you get low amount of nutrition to the brain and the different parts of the brain, and mainly the ones that connect to what I just went over. And so if you got a frontal headache, then that would tie in with the Gluteus Minimus. And if you got a eye headache or back of the head headache, right through here, that's more the Gluteus Medius. And then if you have pain on the side of the head, that's more Gluteus Maximus. So the treatment is real easy. You just basically stretch from here to here. You do light stretches, and then you have to breathe kind of quick, and you when you blow, you go, and you stretch the muscle. And it's I've gone to seminars and they say it's helpful for autism and people that aren't breathing fully. And so once you start breathing fully, you get more oxygen to your brain and your whole body, and so you feel better. So that's the reason behind the treatment. And so that's the gluteal muscle treatment for restoration of the endurance. And this is part of the other treatments that I already went over. So this is at Powers Chiropractic in Plover, Wisconsin, 715-341-7102. And if you want to schedule an appointment, call or need further information.